Cupping, also known as vacuum or suction therapy, is most well known as a Chinese alternative medicine. But the benefits of cupping specifically for lymphatic drainage and lymphatic health is gaining a lot of attraction and popularity. My name is Kelly and I am a physical therapist and I specialize in lymphedema as well as oncology and women's health. And as a lymphatic specialist, in this video, I'm going to show you how cupping is used for lymphatic drainage in a clinical setting as well as for at home. Standard Chinese cupping does use the cups with a heat, such as with a match or with fire, but there are a lot more suction type options now, which can be done more in the home. Cupping is used as a negative pressure technique or treatment. Negative pressure as a piece of conservative lymphedema treatment is a newer concept. It's also used now a lot more for treatment of an injury or even for bruising. Cupping is most commonly used for scar areas or tissues that are bound down, such as from fibrosis from radiation therapy, as the suction does a lot better job of picking up the tissue more than someone's human hands can. With standardized complete decongestive therapy or lymphatic drainage massage, compression is the main treatment option. So for example, if someone has swelling in their feet and their ankles, they'll use a compression stocking to wear to help shrink the swelling. And for any scar tissue or scar restrictions, myofascial release or manual tissue rolling are techniques that will typically be used to help soften that area. Now the difference is with negative pressure therapy, the thought is almost the opposite. So instead of trying to mobilize by pressing down or the compression pushing against it, the negative pressure therapy is used to help lift the tissue, lift the skin up to allow for more lymphatic drainage, lymphatic flow, as well as lifting up the tissue to help break up any scar tissue or adhesions from the tissue being bound down underneath. I am going to do a much more in-depth video on negative pressure therapy, including all the different types of negative pressure therapy, not only cupping, but also kinesiotape and other ways. And that video will be coming out soon, so if that is something that interests you, be sure to subscribe down below to see when that video comes out. So going back to the cupping or the suction therapy, for the sake of this video, I'm just going to be talking about the suction piece of it, not the heat-induced version. Cupping or that negative pressure will be used in a similar pattern that lymphatic drainage massage is done, just to allow for the skin to be picked up all the way along that lymphatic system. There are various types and styles of cups. You will find some that are more the glass type, which are a little bit more professional, that you will use a hand squeeze for. You have other types that you will press down and squeeze, and they come in all different shapes and sizes, even small ones for something like the face or under the eye. You will also see the larger ones that need two hands, but if someone is doing this for themselves at home, it is a lot easier, in my opinion, to have something that you can do with one hand. They are pretty reasonably priced. These ones are a little bit more expensive, but they are much more durable. They are made more of a plastic or glass, and these ones are more silicone based. I will place some links down below for various options that you can check out. In the clinic setting, the most common option is the Lymphatouch, formerly known as a PhysioTouch. It's a medical device that one can use as a mechanical cupping or suction tool. It can be used for lymphatic drainage or also be used for scar mobilization or to decrease any fibrosis to an area. Positive things about the Lymphatouch for therapists is that it does decrease the strain on your hands from using them all day. You can also set the amount of pressure that you're allowing that suction to give. So that is a much more controlled setting for any safety issues. The cons of the LymphaPress is definitely going to be the price. It is much more expensive than a simple tool is going to be. The Lymphatouch comes with multiple different size heads so that you know that you can fit to each area of the body based on what the patient's needs are. But because most people don't have access to one, for this video I am going to go specifically more into the handheld versions for the cupping. One thing to note when you're doing this at home is you can't control as much pressure that you're pulling with. So it's always best to talk to your doctor or your provider or your clinician who specialize in these tools to help get an idea of what is safe for you, to make sure that you are cleared for any issues, such if you have any clotting disorders or you're on blood thinners or you have active cancer to the area. Those are all things that we would not want to use these for. However, you also want to make sure that you get that feedback to know what is the best amount of pressure to give so that you don't cause any bruising or further swelling. Because if you have that damage to the area, that can lead to worsening of the lymphatic system or lymphedema. So I'm going to show on the arm today as well as on the face just to get an idea of how we would use this in a therapy setting. So for the arm, I'd use a more moderate sized cup. There are various options, one larger ones, which are typically better for the leg or the back, and smaller, more moderate sized ones that are used for the arms or other parts of the body, as well as really small ones that are used more for the head and the neck. So for the arm to show you, if you give a little bit of squeeze at a time and you want to make sure that it's all the way against the skin and then let go, you'll get just a little bit of lift, and you may not even see that very well, but you can feel it. If you squeeze a little bit harder, you're going to get a lot more lift, like that. And I'm coming off of it pretty quickly. I don't typically hold as long because if I'm doing it for treatment, I'm doing it in a different form or fashion than you would if you were go to a Chinese medicine practitioner who will hold them a little bit longer, more for myofascial release. When we're doing soft tissue mobilization for scar mobilization or for lymphatic system, they are done in smaller bouts. And what we'll do is we'll work in the way of the lymphatic system. So starting on the outside and working our way upwards towards the lymph nodes, which in this case would be in the armpit area. So small little bouts of section all the way up the arm. And again, I would focus in more areas that are fibrotic or thickened, that have thickened from the swelling itself or from another issue such as an injury or surgery. So that is why I like this type of tool, because it is really easy to use with the one hand, especially if you're doing something like the arm, and it's easy to control. And again, the other type of option that I have is this silicone one. It's a little bit harder to use if you have any thumb issues, but the same concept is it will suction all the way up. And I know this one's going to be a little bit harder to see because of the angle. But again, I'll place a link down below specifically for this size. If someone is doing a leg, I would do the same concept, working up the leg. As we know, the lymphatic vessels run towards the lymph nodes that are in the groin area. And for the back, they will wrap around the hips towards the front where the groin is. If someone is working in the upper back, they may work again towards the armpits, just coming from the back side. When specifically thinking about the head and neck area, again, this is a very delicate area, so we will be very cautious in this area. You want to look for smaller ones. I would think this one that we use on the arm is a little bit large, unless you're doing a large surface area. This one specifically is for the face, so it's a little bit smaller, and it will work on the facial structures in a light way. They even come this small if someone is working specifically, around the eyes. And I don't know if it's going to be easy to see, but it will suction up pretty well. So you can see I'll pull my skin away a little. I would not recommend doing this, but just so you can see that it does stick. Okay, so they come that small, but in general, when someone is using it, they'll use one just a little bit bigger to cover a little bit more surface area. So when thinking about, again, what direction or what sequence would we use this cup in, I would always look for the restriction if they have scar tissue. I would always start with my hands and doing some soft tissue work first. But if someone is using it for that and want to use that in a safe way, then we want to think about the lymph vessels running towards the ear and then down the side of the neck. We know that the lymph nodes sit underneath the ear and above or around the clavicle or collarbone area, and the vessels run from the middle of the face out towards the sides, towards below that ear, and then down. So I always start with massaging around the lymph nodes because I think that's going to be the best to stimulate the lymph nodes, doing 8 to 10 circles around that area, around the collarbone or clavicle area, and you can also do them under the jaw. And I have plenty of other videos that I go more in depth on this. I'll put a link for one of them up above and down below that you can check out for more information on specifically lymphatic drainage massage using the hand. When using the cup, you always want to be gentle because there are a lot of delicate structures in this area. You really don't want to bruise. This is a more sensitive area. And so you want to find something nice and light. But same thing with small strokes, you can work outwards towards the sides, towards the ear, thinking of that negative pressure really gently in that direction. If working around the middle of the face, same thing, starting on the inside and working out towards the side, or from the forehead, working out towards the side. When you get to certain curvatures of your face or different contours, the larger ones get to be a little bit more challenging and the smaller cups get to be a little bit easier. There is one more size smaller than this one for this type or this brand, and again, I'll place some links for that down below. Although there is some more evidence for instrument-assisted soft tissue mobilization just in general, there's not a lot of research done for cupping specifically related to this issue, as a lot of things are used in Chinese alternative medicine. A lot of evidence right now is just anecdotal. A lot of people find the benefit of them. I know as a clinician, using the hands is not always easy, especially in a fibrotic or restricted area. So using various tools is something that we definitely do. If someone is trying to do cupping specifically, they want to make sure that they're doing it safely, that they get clearance from their doctor or their clinician, and that they learn the correct technique so they don't cause any damage or irritation. I do definitely see benefit of using this type of thing. It does help bring some blood flow, and I see people heal a lot faster when using it, but it does have to be done correctly and safely. I am going to keep reviewing various tools and options for lymphatic drainage or tissue release. So if that is something that you're interested in, be sure to subscribe down below and press the like button if you found this video helpful. And I'll see you all next week. Thanks everyone.